6-minute walk test, or 6MWT, is a submaximal exercise test that entails measurement of distance walked over a span of 6 minutes. The 6-minute walk test distance provides a measure of integrated global response of multiple cardiopulmonary and musculoskeletal systems involved in exercise. The 6MWT provides information regarding the functional capacity response to therapy and prognosis across a broad range of chronic cardiopulmonary conditions.
So ideally, the test should be conducted on a straight 30-meter track. But if the track needs to be adapted or shortened due to lack of space, ensure that the patient walks the same course on each test. MWTs are often recommended for initial assessments due to the capability of the patients to have a learning effect. However, recent studies say na kahit isang test is acceptable. Should you choose to do repeat measures in succession, this should be done each time so that the measures are consistent and there should be a duration of 15 minutes to allow for recovery. Equipments needed: 6MWT recording form, rate of perceived exertion, Borg scale, pulse oximeter with appropriate sensor, stopwatch or timer, chairs, sphygmomanometer and stethoscope, trundle wheel, clipboard or recording sheet, portable oxygen if required.
Blood pressure and heart rate should be measured and potential contraindications should be assessed. The use of pulse oximetry is optional. If it is used, it should be ensured that the readings are stable prior to the starting of the 6MWT and the signal is optimized. Supervisor should walk a lap to demonstrate the performance of the test to the patient. Before the test starts, the patient should stand up and rate his or her dyspnea and fatigue. The Borg scale may be used for this. Never walk with or in front of the patient, as the patient may try to match the supervisor's pace. Resting during the test is allowed, but don't stop the clock.
Provide the following standard encouragements in even tones. Do not use other words of encouragement or body language to speed up. At 1 minute, you're doing well. You have 5 minutes to go. At 2nd minute, keep up the good work. You have 4 minutes to go. At 3rd minute, you're doing well. You're halfway done. At 4th minute, keep up the good work. You have only 2 minutes left. At 5th minute, you're doing well. You have only 1 minute more. At 6th minute, please stop where you are.
Stop the test if the patient develops chest pain, intolerable dyspnea, staggering, diaphoresis, intolerable cramps, and/or ashen appearance. Test supervisors should be trained to provide appropriate care at this point.
Change in 6WMT distance can be measured in several ways. The most common include absolute change, post-program distance minus pre-program distance. The minimum important distance is 25 meters in patients with coronary artery disease and chronic respiratory disease. Percentage change, post-program distance minus pre-program distance over pre-program distance times 100. Be a more relevant measure for frail patients whose baseline distance
is very short. Example is less than 100 meters.